just really appreciated your guidance on figuring out healthcare, the whole healthcare situation for me and my family. And I'm getting a lot of questions from folks who are like, who use the ACA Marketplace themselves and have heard a lot about like subsidies going away and all different kinds of stuff going on. So I just thought it would be really nice to hear from you, who's way more informed than me.
Sure.
Um, about that whole situation. So just to kind of like start out, if you wouldn't mind introducing yourself, so folks know who you are.
Sure. Sure. My name's Ron Nemetz. I'm a insurance broker. I'm based out of Buda, Texas. Been a broker for, let's see now, 18 years. So I was one of the early adapters into embracing healthcare.gov as an agent. It was a whole different market when I first got into health insurance back in the days where they could ask you medical questions, you could be denied coverage and things like that. So I was in the industry before that. So some agents, when this changed, got out of the business because they cut how much they paid us because there was smaller gaps, things like that. I kind of embraced it because I figured I could help a lot more people, which is kind of a nice thing to do.
100%. And I remember the first time working with you, I was like, wait, I don't have to pay. Like I'm getting your advice and I'm not having to pay. Like, what can you explain how that works out? And like how
Sure. Yeah,
we,
absolutely. So whether somebody's going on to healthcare.gov themselves to find a plan or they're using a broker, it's the same cost. Okay. So there is no extra fee to use a broker. Uh, they put us in place because one, they find that people that buy their plans through a broker are more satisfied with their plans. Two, the person that, oh, let's talk about that first. More satisfied because a good broker, we're not all the same, obviously, but a good broker is going to, review your doctors or your medications, explain how plans work. So you have a full understanding of that. And when the consumer understands how their plan works, who's in their network, how their copays are going to work, how co-insurance works, how their meds are going to be covered, they tend to be a lot more satisfied with their plan because they know what to expect going in to the year, right? So, and they find that people a lot of times that do it on their own, they might just go pick the cheapest plan, not realize their doctor's not a network, not realize how their medication's covered, things like that. So, that's a difference. So they find that satisfaction is up, which means retention is up, and people will stay on insurance, right? So that's a big thing there. Uh, Secondly, what did I lost my train of thought? I'm sorry. So you asked about why we're free.
yeah.
Oh, again, so the second part of why they use us, especially insurance companies, they realize that the consumer has a point of contact now throughout the year instead of them having to hire a bunch of internal people in the background that know nothing about you when you call in, right? So we're there to answer questions that arise through the year. If somebody has how does this claim supposed to work? Is this right? Or, what alternatives can I take instead of this tier three medication that's costing me this much money? Things like that. We can help go through, a formulary lists and see alternatives that might be a generic that might work for them. So things like that, back end support. I can't tell you how many times people have emailed me from the emergency room needing an ID card,
Oh,
right? So things like that, I can usually pull them up in the back end, get them their ID cards or numbers and things like that. So that's what brokers are.
yeah, and I appreciate I'm not great with math and you have done a lot of math for me to help me figure out like how to compare plans sort of apples to apples in a way that like I would have struggled to do on my own. So, yeah, for others who are not great at figuring all those pieces out, working with a navigator I think is so helpful.
So there's a difference, right? There are navigators and there are brokers. Okay, those
Okay.
are two distinctly different things. Okay, so an assister and a navigator is somebody that's paid for by a grant. Basically, there's federal grants for assisters and navigators that are used to pay for a navigator to help you through the enrollment process of healthcare.gov and things like that, and you know, get you enrolled, show you plan options, things like that. But a broker is beyond that because we're trained and appointed by carriers, and it's our year-long profession, right? So it's a little more enhanced than a navigator. And navigators have to be unbiased. So there's no problem about that. And brokers, legally, we can be biased because places pay us, right? So there are some carriers that don't pay us, like Sendero Healthcare doesn't pay us. And this last year, um, just the 5 days before open enrollment, Baylor Scott and White said they're not going to pay us this year. So there are some carriers that don't pay us. I find when I go through plans, if somebody's fits the Sendero plan, I'm going to tell them about that. And I'm going to tell them last year I helped them enroll. This year, the government said that we can't even help them enroll this year. So, but I'll tell them that this is the plan that would make sense for them. And they'll have to call healthcare.gov or do it on their own, unfortunately, or use one of those navigators.
Gotcha. Okay. Um, so something that I was wondering about for my own self, and a lot of friends are asking me about for 2026, there's confusion about like which subsidies are going away. Are all subsidies going away? Some not. Can you say more about that?
Sure. Can I share my screen?
Sure.
All right. So let's talk about subsidies. So originally, when they passed healthcare, the Affordable Care Act, otherwise known as Obamacare, they had certain subsidy levels that were structured in there. And with those subsidies, it's always based on the second lowest cost silver plan. So this is an example of last year. So if I had a 62-year-old making $22,000, they made these enhanced subsidies starting when COVID started, which lowered the amount people had to pay for their insurance, right? So it was based on the second lowest cost silver plan in the market, which last year was this. So if you made between 100% of federal poverty level, which last year was a little over 15,000, and under 150% of federal poverty level, which was about 21,500 last year, you got a $0 silver plan. This is called the base plan. So this was the base plan in the market last year. This plan would have cost you zero. And what they did then is they gave you enough subsidies to cover that whole premium. And then you could use this subsidy amount to pick any plan on the exchange. So whether it was a bronze, a gold, a silver, you could use that amount, which was based on this second lowest cost plan, to buy whatever plan you wanted to. Okay. This year, that reverts back to the levels that were in place before COVID. So the original amount for 22,000, let me pull this up here real quick, this complex chart. So in this case, somebody making 22,000 has to pay 3.6% for that second lowest cost plan. And then your subsidies were based on this particular chart. If you made 35,000, that second lowest silver plan would cost you 7.5% of your income. So that's part of what's changing, is how much subsidies they're covering when you're eligible for them. Okay, so that's the first thing. So people will see an increase no matter what, typically. The people that used to get plans for free on the silver level are going to pay 2.1, and it goes up from there, right? So last year, 28,000, you paid 1.2% of your income for that silver plan. And this year it's 5.6. So if your plan went up quadruple in that case, right? But this was a low cost though. So you only had to pay 1.2% of your income, which isn't very extensive at 28,000. So most people that are between 100% and 100 or in 400% of federal poverty level lost a little bit of their subsidy amounts, right? So they're paying more in general. The biggest hit though is going to come at, let me give you two examples. And I've used an older person here because it kind of really shows what we're looking at. So last year, this 62-year-old person making 62,600 was eligible for 734 in subsidies. If they went to 62,500, it started to be a sliding scale where they would lose just a little bit. Basically, they'd lose $71 a month for every $10,000 over this level. So it'd go from 735 down to 644. So it'd slide. So if you were above 62.6, you'd lose per month on a subsidy. So this particular 62-year-old, as you can see, would probably get partial subsidies all the way up to about, well, it's even harder than that. Let me do the quick math, 150,000. So even at 150,000, they were getting 115 bucks,
Mhm.
right? So this year, if you're at 62,600, you're getting a subsidy of 886. But if you go to 62,601 as a single person, you lose it all.
Oh, wow.
So that's called the subsidy cliff. So basically, you go $1 over that cliff and you lose all the subsidy assistance that's available. Now, this depends on family size. So, family of one at 62,600, family of two, I got my chart in front of me, so I'm not misquoting myself.
Mhm.
Family two is 84,600. Family of three is 106,600. Family four is 128,600, right? So, this could get, pretty high. I dealt with a couple of people earlier today. They were both 55, just to show you an example. And they had two kids in college, 21 and 20-year-old. And last year, they make about $175,000 a year, which isn't nothing to sneeze at, right? It's a fairly decent income.
And with the ACA, people can still have their children on their plan up to age 26. Is that right?
Up to age 26, you can only use a subsidy, though, if you're taking the child as a dependent on your taxes.
Mm-hmm.
Okay, so in general, for subsidized people, you're looking at kids that are in college yet under the age of 23 in most circumstances, right? So, but look, this couple last year, 175,000, they were getting a $1,400 reduction on the cost of their plan. Okay. So they could get a bronze plan in the market. Oops, expanded bronze. So they could get a bronze plan in the market for, 600 bucks, right around there for a higher deductible bronze plan. This year, that same couple making 175. Let's get off of silvers. We go to bronze. But their lowest cost plan this year is 2176.
Wow.
And that's just their lowest cost plan. That is the absolute lowest cost plan in the market for that family. So that's a big difference, right? You go from having plans that are around $600 to 2176. That's what we're facing right now.
And this is all because of those extended subsidies that were put in place during COVID are going away.
Correct. They were when they passed it during COVID, they only extended it till December 31st of 2025.
And in
So
order for those to be extended, Congress would have to vote to extend them, right?
correct. Congress would have to vote for an extension. And supposedly they're going to debate that and vote on it in early December. And we have our fingers crossed that there's a better resolution for people because, if you look at this same couple, this is why I find it most disturbing. Let's say that's the same couple. Let's say it's two 55-year-old retired people and they're making 90 grand. They're paying 1509 a month, right? That's $18,000 a year for their insurance and still with having, let's say they're even older. Watch this. I say they're early retirees at both at 63. And let's say that, they got a fixed income of 90,000 that they can't control. They're getting 90,000 no matter what. Cheapest plan's 2,000. That's $24,000 a year.
Wow.
And nothing says that this plan fits their doctors, right?
Yeah.
They might have particular doctors or medication that they really want in network, but that is the absolute lowest, right? $24,000 a year with 10,000 max out of pocket. If they both had a bad year health wise, they're potentially paying 20 grand on top of 20 $4,000 in premiums, that's $44,000. That's half their income,
Oh my gosh.
right? That's why this is pretty important for the to resolve this type of issue.
And because we're all, so let's talk for a second about the timeline for signing up for plans, right?
Mhm.
So I know in order, or at least my understanding is that in order to have my plan still continue January 1st, I need to be signed up by December 15th. Is that right?
That's correct. And there's two windows. They when they originally passed the law back in July, now I think it was. Originally they were going to shorten the window to just be November 1st to December 15th. Okay, but they got some pushback from brokers like me, things like that. So there's two windows. November 1st to December 15th is for plans starting January 1st. Then there's a second window from December 16th to January 15th for plans starting February 1st. So you got two windows in case you missed the first one.
Okay.
If you're currently enrolled on the plan, though, and you make no changes by December 15th, that plan will auto renew for you. Okay. So, with the exception of Aetna, who left the market this year,
Hmm.
but the government will have mapped you into a new plan automatically that would pepper you with emails and saying, please pay us for your insurance January 1st, even though you have no idea who they are
Mm.
and might have not signed up for them because the government's protocol on that when a carrier exits the market is to automatically map you to what they consider the most similar plan to what you had previously.
And do they tell you like what is the cost difference or give you any information like that ahead of time, or they just send you a bill?
They just send you a welcome letter with a bill,
Gotcha. Okay.
which is always a surprise,
Yeah.
especially if you didn't know Aetna was leaving the market, and then all of a sudden you get a bill that's probably, and again, if you're a subsidized person, right, and you're not paying attention, you might have been paying 800, $900 in Aetna last year, and now all of a sudden you're getting a bill from a carrier saying, welcome to us, and your bill this year is $2,700. So
Yeah. Um, and so, we're a lot of us are signing up right by that December 15th deadline, but if they do vote to extend the subsidies, what's that going to do? Because that's going to change the information that we're looking at now, right?
I'll probably work twice as hard than I already do. And so here's what I'm doing for all my clients that are in this level, right? So I go through and I do their application the same way that we would have did it last year. We put their income projections in there and things like that, even though they're not eligible for subsidy technically, because by doing that, it's queued up and ready to go. So if they pass subsidies and reinstate them, I can basically hit a button to resubmit the application and get the subsidies applied. Okay.
Mm.
So the hope is that they do, and again, if we look back here, if they do the same subsidies, all these people will also get increased credits, right? So even though you're still getting a subsidy now, that may go down if they put in the old subsidies. So all those people are queued up, ready to go in case that happens. So we can just resubmit, reapply their subsidies because you can modify income at any time of the year on healthcare.gov, right? It isn't a one-time year to modify your income. You can only pick your plan one time a year, right? Or January 1st or February 1st, unless you have a qualifying life event like having a child or getting married, things like that. But essentially you are locked in when you pick your plan, which is kind of hard, maybe, because if they extend them in December, right? We got to January 15th to change plans, but somebody might be going up to a bronze plan this year just for affordability, whether they really wanted a gold plan because it covered a medication better, right?
Mhm.
So that's the difficult part. So hopefully, if they do extend them, they would give us extra time to make changes if needed. That would be my hope. Will they have that much forethought to do that? I don't know, but that I would hope they would give us some time to make modifications to the plans you signed up for.
Mhm. And even if the extended subsidies even if they don't vote to continue those, there are still some subsidies that were already in place and that will remain in place. Is that correct?
Yeah, so this family of two, right? If they're making, oops, 84,600 or less, they're going to get a subsidy of 2185, right?
Okay.
So it's if they go a dollar over that, that they're going to lose the whole 2185 a month. So that same family now goes from having to pay 2000 a month to paying zero on one, two, three, four, five, six plans. They have a choice with a zero premium. Okay. So it's a huge difference. And for planning purposes, I will tell you, and I talk to my customers about this all the time. I was having flashbacks of 2019 yesterday because I had a couple of customers that were right on the edge.
Mm.
So this 90,000 couple, not getting a subsidy now, losing $2,100 a month, which is $25,000 a year. Well, you get a couple things you can do. All these bronze plans are going to be HSA qualified this next year. Okay.
Oh.
So any bronze plan we only had two bronze plans last year that were HSA qualified. This year there's 27 of them, I want to say. So as long as the plan is bronze, it's HSA qualified. That was part of the law they passed this summer. Well, what does that mean for you? Well, that means if you have a fixed income of 90 and you need to ditch some income, you can contribute to an HSA account, right?
Mm.
And contributing to an HSA account lowers your adjusted gross income for the year. As a matter of fact, it's one of the questions that's on the application. If you have any adjustments to your income, like contributing to an HSA. Well, a family of two can contribute $8,750 to an HSA, plus they're over 55, so they could both contribute $1,000 catch-up allowance. Okay, so if this couple has this 90,000 and they stick 6,000 into an HSA, that puts their income back to 84. Whoops. And now they are getting a subsidy of 2190. So
Okay.
by sticking 6,000 into their own personal savings account for medical claims in their future, they're gaining $25,000 of subsidies a year.
Okay, I've only ever used a health savings account if it was through an employer, but it's available to those of us who purchase our own plans.
Absolutely. You can just go right onto a place like fidelity.com
Oh,
and start an HSA account there and fund it. As long as you have an eligible account, you're able to fund an HSA. So that's the clue. That's the deal. You can fund an HSA as long as you have a qualified plan. And again, that limit next year is 8,750 for family and $1,000 catch-up allowance if you're over the age of 55, right?
okay.
So, and
New
then
information.
you can use those. You can use all those that money for any medical expenses, for dental, for vision. Doesn't have to be a part of the plan. It's not tied to the plan. It's just the federal laws. You have to have an HSA qualified plan to be able to fund it. Okay, so things like that. Then if you get really, and these are things like navigators might not know, right? Because
Hmm.
it's more intense stuff. But you could do things like, so that family, $10,750. Let me just do some math real quick. 10,750 plus 84,600. So that brings them up to 95,350 if they contributed a max amount that they could potentially lower their income, right? They could also, let's say they made 100,000, right? So again, no subsidies, but at 100,000 of income, you could do 10,750 for this couple that's over 55 into an HSA account. You could contribute to your IRA account. So not a Roth IRA because that's post-tax, but a traditional IRA. You can contribute to that to lower your income as well. That's also a question on the application about deductions. Both of those things lower your adjusted gross income and could get you under that 84,600. Again, in my opinion, you're paying yourself into an IRA or paying yourself into an HSA account for $25,000 of government assistance in this particular case.
That's right. Interesting. See, this
So
is all that stuff I never would have been able to figure it out on my own.
mhm, just different things. Again, I've been doing this since it started 13 years ago. See, these are conversations I had a lot in 2012 through 2019 before COVID about how you could adjust your income by different means. So, good stuff.
Cool. Okay, I feel like this has been super helpful and hopefully will clarify some things for folks and give folks some additional stuff to think about. But I'm curious, for those of us who are anxious about, enrollment and what might change and just feeling a little unsure, like what is your advice for folks who as they're signing up?
So, my advice to folks typically when they're signing up is if you're signing up, you want to get something that's going to fit your needs, right? So, uh, can I give you some examples of things brokers do? Like here's one I was talking to earlier today, so I left this one out actually. So, like the Sendero plan, somebody was telling me, hey, they signed up for Sendero last year because Matthew Brimberry was in network. Well, if you dig farther into the details, you'll find that he's covered at one place, but
Oh.
but not covered at another place, right? So sometimes it depends where your doctors are at. This particular person practices at two different places, and he's in network at one, not in network at another. So that makes a difference, right? Um, make sure that, especially if you have expensive drugs, you know how they're going to be covered, right? And
Mhm.
this is something that people don't know. Like they might see this, they might take this Aimovig, right? They might think, hey, it's $50 copay, right? They don't realize after deductible
Mm.
and what that means. Well, that means you got to pay the full price of that drug until you hit the $7,500,
Mhm.
right? Things like that. So making sure you know how the plans work compared to your doctors, your medications, have a good understanding of that. Go into the plan details. If you go into plan details on a plan, for example, this is the way to read these things in case people don't know, right? Your deductible is going to be at the top.
Mm.
And then the key verbiage in these plan details is this. If something says deductible does not apply, that means you get the copay. All right. So, like this is the case, a doctor's visit. Deductible does not apply. So, you don't have to pay the first $7,500 first. You
Mhm.
just pay a $50 copay. So, that's the key verbiage in these things. Deductible does not apply. Because when you get down to here, 50% coinsurance per test, a lot of people are going to think, yeah, I just got to pay 50% of it. That's not the right case. It's 50% after your deductible's been met.
Oh,
So you got to pay your full deductible first because it doesn't say deductible does not apply.
gotcha.
Okay. So understanding your plan is a big key to having confidence in your plan going forward. So again, that deductible does not apply is key verbiage in all these particular plans. And knowing what the co-insure or the deductible is to begin with and things like that. So, that's something like that. So, but as far as, anxiety over this enrollment period, you know, unfortunately it is what it is right now. And we just have to see if they come to some resolution that's gonna to help and benefit people. I firmly believe they should do that. And I'm a guy that typically runs a little bit to the right as far as fiscal conservative, right? So I'm a pretty fiscal conservative guy, but putting people in this situation where these prices are going to where they are is just ridiculous to me. And, it's not the consumer's fault that prices have got so high over the past couple of years, and there should be assistance for them instead of having to pay. I mean, paying 25% of your income for a high deductible plan is just beyond the pale to me. So, but all we can do is cross your fingers. I encourage everybody to pepper your senators and your state representatives especially if they have the R's after their name, because those are the ones that are hesitant right now about expanding these things. I think most Democrats are on board. So, we got two senators in Texas that are Republicans, and if your local rep is a Republican, I would hammer them with phone calls right now, personally. That's what I think, because there's only going to be action if there's public pushback against this. Is my belief.
Yeah, and I think I feel like it's really important for people to know for themselves like what the cost difference is going to be because I think it's those tangible personal stories that make it more real for us and then also for our reps too. So, yeah, the sooner people can figure out like what the changes are going to be for them, the sooner they can advocate for themselves and hopefully the more of us can speak up
Yeah.
and
I
yeah,
mean, the changes are in place right now,
right.
right? They've been in place since November 16th. So if you're going on to, even if you go on to healthcare.gov, let me show you. Even
Oh, and
if,
that's another question I've been getting. So when people do go onto healthcare.gov right now,
Mhm.
what they're seeing is what is currently going to be accurate for next year with the additional subsidies gone.
Correct,
Okay.
correct. What's in there right now is how the law is set for January 1st, okay, without congressional change. So you don't even need to go into your application to just browse. You can go to this first page. There's a browse plans button, right? You can throw in your zip code and just go in here. It'll ask you about your household. You can skip your plan ID. You can put your demographic information. I'm a 35-year-old male, and you can literally skip this stuff because none of that really matters at this point. Continue, confirm, and then just me and my household. And now I'm going to put my income in there. There it is. So, and again, you can play with these numbers, right? You can put it at one level, think, hey, maybe if I work less or work more, how much that would affect you. But you can just put it in there. It'll tell you your cost estimate is 239 a month. So if you put more than your max income, right, you'll know because this will go down to zero, um, and things like that. Could I get to say one tip here really quick too?
Yeah.
A lot of people make mistakes on these plans and they try to underestimate their income.
Mm.
And I'm going to show you how that can be a bad idea. There's a minimum amount people don't realize. That minimum amount for a single person right now is $15,650. So if you went in there and said, and you underestimated your income at 15, you would get no assistance and you'd have to pay full price on your plan.
That's wild.
Okay, let me show you it on this screen. Let's say the same 63-year-old couple, they're only going to draw their family too, so a little different level family too. It's 21,150. But let's say they say I'm going to only make 20 grand this year. They get no help because they're under the level. You got to make at least 100% of federal poverty level. So for them, 50. If they make 21,150, now they get $2,800 of assistance.
So if they're under that level, does that mean that they qualify for Medicaid or
Not in Texas, it doesn't.
that's
So
right, we didn't expand Medicaid.
correct. So those people fall into a loophole where there's no Medicaid for able-bodied adults in Texas, and they're under 100% of federal poverty level, which the original law they passed back in the Affordable Care Act, no subsidies if you're under 100% of federal poverty level. So yeah, I see that happen all the time, especially for people that work restaurant jobs and things like that, that they may or may not claim all their tips. You know what I'm saying? So, but or maybe it's somebody that's going to college and they have a part-time job or something like that. So if your income is close, I encourage you to work an extra shift or two to get you just over that line, because I deal with people every year that call me just they put in their income just under that line. They don't even realize how much that affects them.
But in other states that did say, yes, we want to expand Medicaid, those people would have been covered.
Yeah, under the state Medicaid program, places like where I came from, originally Illinois, they have a robust Medicaid program that's quite high. Actually, goes up to I think 138% of federal poverty level, and the CHIP levels even go up higher than that. Okay, so another thing people should be aware of probably if they need to, especially if they're Travis County, is the MAP program. Are you familiar with that at all?
No.
So it's the medical access program in Travis County.
Okay.
Okay, so this is plan for people, and I think it's here it is. So it's available for people making less than 200% of federal poverty level. So this is basically so anybody below. So if you're below that 100%, you can get onto MAP. You can apply for MAP, and it covers doctor's visits, prescription meds, hospitalizations, things
Okay,
like
so this
that.
is like a county effort to try
But,
and make up
yeah,
for the state not
correct.
looking.
This is kind of like county-based Medicaid instead
Got
of
it.
state-based Medicaid. Okay, so but that's a program that's available to people, and it varies by the county you live in as far as the income standards go. So, but in Travis County, it's called MAP right there, and it gives you help or assistance, especially if you're under because if you're between that 100 and 200%, there's all kinds of subsidies to help you, right? But if you're under the 100% of federal poverty level, this is definitely the place to go if you're in Travis
Okay.
County.
That's good to know. I had not heard of that.
Yeah.
Okay. Any other things that people might not know about that could be helpful?
Um, the only thing I can think of that I didn't go over yet is, the when we're talking about how a broker can assist you, and again, we don't get paid money by you directly, right? It's from the companies. It's things like I put up an example earlier. Where is it? Here it is. No, Remicade. That's the one. So a lot of people, again, that don't know insurance lingo, might go into a thing and see Remicade's an infusion you take for arthritis, psoriatic arthritis, for example. And you'll see on a lot of plans they don't cover Remicade. It says it's not covered. Well, that's not necessarily the case because Remicade, if we go to Blue Cross, for example, and we look on their plans. So if you go to Blue Cross, for example, you'll see Remicade's not covered,
Hmm.
right? But an experienced agent knows that Blue Cross has a back end formulary for specialty drugs that are administered at the doctor's office,
Oh.
where I don't know how the average consumer would find this type of information
Yeah.
with not knowing about it, but we can look on there. So if that person has Remicade, I can look into here and look for that particular drug and see whether it's covered or not under these particular circumstances, right? So there's a lot of drugs on the specialty list, that would be covered that are infusion type drugs. So,
Mhm.
that's so you gotta know where to look in the details sometimes. So, because things like infusions are covered at a doctor's office, they don't go under your formulary list. So, knowing these particular things are helpful.
Totally.
Yeah.
So I feel like at least for me, it was definitely has been my best bet to talk to a broker. And if other folks are after listening to this conversation are like, actually, yes, I would like to talk to a broker too. How do folks make appointments with you?
I'll be honest, I can't really take any more people this year.
You're full.
I got so many clients that are freaked out about what's going on, and right now I am booked out. And I work from I take appointments from 7 in the morning till 9 at night. And right now my next appointment availability is not till the 25th.
Okay.
So even though I'd love to help more people, there's only so many people I can help before I just run out of energy
Of
and
course.
things like that. But here's what I'll tell you. You can go on to healthcare.gov. And I'll tell you what, if people want to call me in a couple weeks, I might have more flexibility
Yeah.
at that point, and they can always email me, call my office. and things like that. But on healthcare.gov, there is a find local help button right here where you can go in, you can look for a broker right here. You can put in your zip code. You can search. There's an agent or broker thing. So there's, as you see, there's 15 assisters.
Okay.
So, so that's it. So it's usually these are mostly, again, they're funded by grants, right? So there's not that many of them
Hmm.
because they gotta apply for those grants every year, and there are 635 agents registered
Hmm.
in the system. Now, personally, what I would do is I'd probably go look for agents that have been doing
Hmm.
this a long time, right? Because they have more experience, and you'll find there's 63 people locally that have been in doing this for 13 years, which
Wow.
is how
Okay.
which is how long healthcare.gov's been around. Yeah, I mean, again, if you do want to reach out to me, uh, I'm booked out 2 weeks right now. I try to help as many people as I can, but I understand that people can be impatient or anxious about this and they want to talk to somebody right away. And you can, again, go into this find local help button, agents or brokers. I would, again, look for, guys that have been around 10 years, obviously have a lot of experience in this, and there should be somebody that should be able to help you research what you're looking for.
Awesome. That's a
So
great tip.
the problem is I got like, I don't know, 1,000 individual clients. I got a lot, and it's a lot of people to fit in the 45 days before December 15th. So,
Yeah. I know it's such a tight window.
yeah. All right.
Well,
Anything else that we missed here that you wanted to talk about?
let me see. No, I feel
Oh,
like we covered it all.
I think the only thing you put in here that we didn't cover was changes in plans for next year.
Yeah.
So the biggest change we had is there's Aetna leaving the market.
Okay.
So anybody that's on an Aetna plan that last year, if you don't know, you got to go find a new plan, or else the government's going to automatically change you over. And then the only addition we had was Harbor Health, and let me take those numbers out of there because I used a really old couple not available for subsidies. So Harbor Health is going to offer gold plans and silver plans, but zero deductible gold plans.
Mhm.
Their network's really neat. They're the only carrier that I've seen in the last 10 years that have had Austin gastroenterology in the network,
Hmm.
for example, which is uh, something we haven't seen in a long time. Harbor Health has like 11 clinics locally. So they're a primary care facility clinic that
Okay.
started their own health insurance company, and they've developed, it seems like a very solid network of specialists. So this is a new addition of the market that might make sense for some people. So that's the biggest change that we had. Aetna going away, Harbor Health coming in.
Okay. And that's for all the state of Texas.
No,
Oh.
not for all the state of Texas. This is the Austin area. I think
Oh.
I think next year they will expand to different parts of Texas because they just bought Village Medical. If you know who that is, that was the clinics attached to Walgreens.
Okay.
So they'll be part of their network. So I think they'll do an expansion to the bigger part of the state next year. But right now it's currently this 3 county area basically.
Okay. So what is available to you is like very dependent on where you're located then.
Oh yeah, it's all based on county. Like here, in Austin, we got these on the left hand side of my screen here. We got these carriers, right? But that's very different if you're in Houston, for example. I think that's a Houston zip code. Yeah, it is. Because down there they have community choice is one of the companies that doesn't provide insurance here. WellPoint is a company that doesn't have insurance in the Austin area, for example. So yeah, it is very dependent upon the county you live at, which carriers are available to you.
Okay. I'm learning so much new stuff.
Good. Education is a good thing.
Yeah.
All
Um,
right.
yeah, I think that covered it. And I know you're so booked out and trying to help as many people as you can. So I really appreciate you taking the time to do this.
Oh, my pleasure. And if you have any other questions, let me know.
Okay, thank you, Ron. I appreciate you.
All right. You have a great day.
You too. Get some
All right.
rest.
Thanks. All right. Take
Bye.
care.